Today I want to talk with you about interviewing a patient with abdominal pain. Some students struggle to make the transition between the classroom and the clinical environment. This presentation is designed to make that change more meaningful for you. You and I will be interacting throughout this video. We'll begin with a patient with abdominal pain. A 65-year-old male complains of abdominal pain for 2 days. This is the chief complaint. The chief complaint should include 4 things. Number 1, the age of the patient. Number 2, the sex of the patient. Number 3, the main complaint. And number 4, the time of onset. So a 65-year-old male complains of abdominal pain for 2 days. All 4 components are there. The next step is the history of the present illness, the HPI. The HPI means history of present illness. I am now going to get information about this abdominal pain that will allow me to start formulating possible causes for the pain. So I would ask, when did the pain begin? The time of onset tells me if the pain is acute or chronic. Within 3 weeks is acute, but more than 3 weeks is chronic. Also, did the pain start suddenly, which suggests vascular, such as ischemia or dissection. Sudden pain also suggests perforation and obstruction. Gradual onset suggests infection or food poisoning. The next thing I want to know is the location of the pain. So I would ask, where is the pain located? The location tells me which organ might be causing the pain. Right upper quadrant suggests gallbladder, liver, peptic ulcer disease, or lower lobe pneumonia. Left upper quadrant suggests stomach, spleen, lower esophagus, pancreas, or lower lobe pneumonia. Mid-abdomen suggests small bowel obstruction, pancreas, or early appendicitis. Right lower quadrant suggests appendicitis, Crohn's disease. Now, specifically in females, it would suggest ruptured ovarian cyst, or ectopic pregnancy. Left lower quadrant suggests diverticulitis in persons over 50, colitis, large bowel obstruction, or in a female of childbearing age, ectopic pregnancy. And suprapubic suggests cystitis and genital problems in both male and female. The next thing I want to know is the quality of the pain. So I would ask, what does the pain feel like? Pain may be described as poorly defined, steady ache, crampy, sharp, tearing, colicky, or burning. The next thing I want to know is what triggered the pain. So I would ask, what were you doing when the pain began? Was it before eating, during eating, or after eating? If the pain is associated with eating, it suggests a GI or gallbladder component. Or I would ask, was it while you were resting? If the pain started while the person was resting, it suggests infection or kidney stone or inferior wall MI in persons over 65 with epigastric pain. Or I would ask, did the pain start while you were working? Abdominal pain that started during activity, such as working, could suggest abdominal wall pain, such as muscle pain. The next thing I want to know is the severity of the pain. This is called intensity. It is scaled from 0 to 10. It is unlikely for chronic pain to have an intensity of 9/10. The next thing I want to know is where the pain goes, or does it radiate? So I would ask, do you feel the pain anywhere else? Pain that radiates to the epigastric and left upper quadrant in the elderly population suggests GERD or inferior wall MI. Pain that radiates to the back suggests pancreatitis, kidney stone, pyelonephritis, or spinal infection. Specifically, in the elderly, abdominal pain that radiates to the back suggests abdominal aortic dissection, especially in the elderly. Pain that radiates to the right lower quadrant suggests appendicitis. I also want to know if the pain is still present at the time of evaluation. So I would ask, do you still have the pain? Pain that improves without intervention is less likely to be life-threatening. Pain that is still present or even worsens should be taken seriously. Then I want to know if the pain improves with intervention such as medication. So I would ask, did you take anything for the pain? If the answer is yes, the next question would be, did it help? Now, apart from medication, does anything make the pain better or worse? And this is known as alleviating factors. Now, I want to talk about a few things that's known as pertinent positive and pertinent negative. So, in addition to the history of the pain, there are a few other questions that I'm concerned about. Number one, is there any fever? Fever with abdominal pain is suggestive of infection. Is there any headache? Headache with abdominal pain, headache with associated eye pain and abdominal pain is suggestive of close-angle glaucoma. Is there any lightheadedness or dizziness? Now, a female with a ruptured ectopic pregnancy could develop lightheadedness or dizziness as a result of hypotension, or in the case of an elderly person with hypertension and a dissecting aorta would present with abdominal pain radiating to the back, that person could develop lightheadedness or dizziness. Next, is there any nausea, vomiting, diarrhea, or constipation? I want to know, are there any associated GI symptoms with the abdominal pain? Next, is there any loss of appetite? Normally, in abdominal pain that is of significance, appetite goes. Next, is there any vomiting blood or coughing blood, especially in the alcoholics or persons with peptic ulcer disease? Next, is there any rectal bleed? Rectal bleed in persons with abdominal pain could suggest liver involvement, such as cirrhosis, resulting in portal hypertension. Then you ask, is there any blood in the urine or urinary symptoms? This could suggest a kidney stone. And then, is there any vaginal bleed or discharge? This could suggest a vaginal infection such as PID, or even an ectopic pregnancy with vaginal bleed. Now, the next thing I want to know is if the person has had previous pain. So I'd ask, have you had this pain before? Previous episodes of similar pain, which improves each time, is quite different from new onset of pain with the same intensity. So that's important to see. Now I want to give you a summary of what I just went through, and I'm going to read it now for you. You can follow me as it is displayed. This is a 65-year-old male complaining of "my belly is hurting for 2 days," and try to put the chief complaint in the person's own word in open and quote quotation. Now I'm going to give you the history of the present illness. The patient describes gradual onset of achy epigastric pain, which started 2 days ago, of 6/10 intensity while eating dinner. The pain radiates to the mid-back, has not improved with medication, and is still present. He took Maalox with little improvement and has had similar pain 6 months ago. He has associated nausea, vomiting, but no fever, diarrhea, or cough. And that summarized the history of the present illness, and in fact this gives you a good picture of the abdominal pain. The template that I want you to keep in mind is also displayed, and it goes like this. The patient describes, and you put the speed of onset of the pain, then the quality of the pain, then the location of the pain, then the time of onset of pain, then the intensity of pain, and the activity that triggers the pain, all in one sentence. The second sentence could be the radiation of the pain, the alleviating factors, the present status of the pain, and previous episodes of the pain. And then you can close the history of the present illness with pertinent positive and pertinent negative. And if you master this history taking and documentation of abdominal pain, you will feel much more comfortable each time you practice writing the history, taking the history and writing it down in an organized fashion. The attendant or your colleagues will be able to follow your trend of thoughts, and you yourself will begin to understand how to approach persons with abdominal pain more comfortable, and you'll develop confidence, and in no time you'll master this. And of course, you can use this template as a springboard for taking the history of other chief complaints. Well, this brings us to the end of the abdominal interview. Thank you for watching, and I do hope that you will feel encouraged as you repetitively go over this presentation and become a master of abdominal pain. Thank you for watching. Don't forget to like, share, and subscribe. I wish you well. Good night.